Bring the meeting to order. This is for a study session held today for a study session. An IMA representative will provide information on the city's health plan performance. Welcome.
Thank you.
So actually, we have two IMA representatives
Great.
here to share some great news about where we are this year compared to last year's, and since we've actually transferred over to IMA. So it's a good story here. You've got a booklet in front of you, so I want to welcome Christy Downing and Ron Powell.
Chrissy and Ronald?
Ryan.
Ryan.
Mm-hmm.
Well, thanks for having us. I'm really glad to be here at your study session today and go over some of this great information. And like Tiffany said, we've started working with you guys in May of 17. So this is actually a great look back and also some updates on how we're looking here year to date as well. So we're going to go through this information pretty quickly. Like Tiffany said, I'm Christy Downing with IMA. I work with Ryan Powell on your account. I'll let Ryan introduce himself.
Sure.
Welcome.
Thank
And
you
we
for
have
having
a
us.
team of people that are pictured on page 1 of your handout that you can look at that are our dedicated service team that work with us on your behalf. Just a little bit of information about IMA there. You may not know who we are, but there's just a little bit of some nuggets on our firm and our size. We actually just grew to the 6th largest from the 8th largest, so we're growing pretty rapidly. And Ryan and I actually, one of the reasons why we partnered with the city and were able to work with you all is we work with over 30 public entities in the state of Kansas. And so one of our core competencies is public entity space. And so that's one of the reasons why we're here. So on slide 2 of your handout, what I wanted to do today is just really try to hone in on some key things on why we began working with you, some of the challenges you're facing right at the beginning of our partnership, and then what we're doing to rectify those, and then some forward action items that we're taking. On the City of Pittsburgh key challenges, I just want to hit on 3 today for you guys as a takeaway. One is an ongoing challenge, and it's one we've been able to address, but we're continuing to fight the battle of your pharmacy spend is quite a bit higher than benchmark. So as all things being equal compared to your peers, your pharmacy spend is running a little higher than what we would like. Your contract that you purchased to place your pharmacy benefit manager, or as we call PBM, was lacking some transparency. So there were some overriding costs that were built in that we were able to rectify once we became involved. So that was key challenge 1. Key challenge 2, your reference-based pricing program, which we're going to talk a little bit more in a minute, that is your network discounts for facility charges. Some of you guys might know the term RBP, or reference-based pricing. That is where the city basically left the Blue Cross Blue Shield network and is doing that reference-based pricing to pay facility claims. So we'll talk about that here in a little bit. There were some challenges with the integration on that component. And then really the long-term strategic planning and always continuously pushing the envelope for cost containment is really a mission of Darren and his staff. And so having a strategic partner like IMA to help you really build out that strategy is why we're here today. So today's key takeaway is obviously we're going to show you how you performed and really what the steps you've taken is really laid out as far as savings to the city. We're going to help you understand how you compare to your peers and show you some benchmark data. We're going to show you those provider discounts and show you how that's saving dollars for the city and what that means to you guys. And then we're going to just quickly touch on all of the future initiatives that we're working on right now. It's a pretty long list, but we're going to hit on some key takeaways. So with that, I'm on slide 3 now, and I'm going to have Ryan just quickly go through our initial results post our engagement with you all, and there's some dollars and cents tied to that.
Sure. One of the things that you guys did originally was a direct contract with Via Christi. And once we got involved in your account, we realized maybe there's an opportunity, with the help of Darren, maybe there's an opportunity to drive some additional savings. So we renegotiated that direct contract. Then what that equals in terms of savings is about 8% based on your claims in 18. And if we did a look back and we ran all those claims with the better discounts retroactively in 17, would have been about $100,000, just shy of $100,000. So we continuously, to Christie's point, try to strengthen our cost containment strategies year in and year out. As far as the pharmacy goes, Christie's right. You're about 10% over trend, I believe. And as a result, we've recommended a disease management vendor that's tied to the pharmacy, and that's the Tria Health, as you'll see at the next large bullet. So they are a proactive, they will make calls out to folks that have 3 chronic medications or more, or potentially are missing. They see a history of taking, for example, a diabetic medication. They stop taking that medication, maybe because they can't pay for it. There'll be an outbound call from a pharmacist to ask them, what's the reason for that, and can we help you get back on that medication to avoid something major from happening. So it's a great program. It's helped in a lot of our other clients, and I believe it's going to be good here. It's too soon to give you actual results, but we'll continuously be reporting those results as they come in.
And we have just a snapshot through June. You already have 21 members engaged. There's about 100 identified. So coming right out of the gate, we started this promotion in March. So we really haven't, that's 3 months of activity that Tiffany and her team have been working on. So I feel really good about the initial engagement. We're also building out a full calendar of communication pieces that's just kind of an easy button for the HR team to send out to continually remind people why to engage in Tria Health. So that's an exciting new development that we've started. But you can see Tria Health actually projects the engagement savings, and they're projecting it if everyone were engaged, which we don't think everyone will engage. But you can see that the savings is pretty substantial. So even if we get to 50% engagement, we're going to have a nice savings and bring a nice value to the employees. We have several clients that are running at 45% engagement, so that's not unheard of.
Yep. Thanks, Christy. The next big section is just a little bit deeper on the pharmacy benefit manager. So when we came in, you guys were already with MedTrack. We know those pharmacy contracts fairly well, so that was one of the action items we had immediately, and within 30 days, we had renegotiated the MedTrack contract to strengthen the language, to make sure the pharmacy can't, it's a shell game, and they're making the money unless we can help you strike a better deal. And that's what we did, and you'll see that the year-to-date savings as a result of that is $77,000. We're projecting that to be about $90,000. There's some programs that we've implemented, I'm not going to read through those, that have had some success and helped that savings year-to-date. But at the very bottom, you'll see note that even though we're saving dollars from previous contract, we're not going to sit idle. We've already sent this to market, and we're renegotiating again. And that is coming. What we're seeing today is an additional 10 to 11% savings potential from the pharmacy market. So we are actively in negotiating stage right now, and hopefully going to strengthen that contract even more. The next page. This is just I think is good for you guys to see the cost year over year. So this is your actual cost year over year, the bottom line. And that top line that just kind of keeps going up, that is actual, you hear carriers talk about trend increases, insurance trend increases. These aren't the insurance carrier trends. These are actual employers reporting what their increase, which makes this a more accurate report. So you'll see, if you look at from 2014 to current, you're looking at versus trend, you're $1.6 million better than trend over that period of time. And in 2018, we're sitting at 247,000. So we've done, with the leadership team here, we've been able to implement some really, really positive things. As a result of running much better than trend, you can see a couple of key takeaways at the bottom. Your claims reserve, which means the dollars you have to pay for your self-funded claims, has grown substantially from 2015 to today. And the other positive is your employee per paycheck cost has stayed static in that same time period, which is great for the employees.
And also, you guys have had, as far as I know, no plan design changes since 15 as well. So the benefits have stayed the same. You're outperforming medical trend. Your costs are staying flat for the employees. It's pretty much unheard of to have those three things all going your way. Usually you have to shift something to have something, course correct on the pricing. So you guys actually, this is a great takeaway page for you guys, and it's testament to some of the hard steps you guys have taken prior to IMA coming on board.
Excuse me, who holds this claims reserve account?
You guys do.
We do.
Yep, and Jamie manages that, and I've got some reporting in the back too that you can
Okay.
see. Jamie's pretty on top of the in-go, out-go, and he's got his account set up and structured correctly. And we help you guys with the funding levels, so you're always funded appropriately. Any other questions before we move on?
Yeah, I do.
Okay.
What is Triad Health?
Yes.
What is that?
Yep, they are a third-party disease management vendor that will help.
Third-party disease management.
So they're a company that like when we saw your pharmacy spend continuing to go up, we wanted to engage TRIA because they have pharmacists on staff that will make outbound calls to ask that particular employee, how come you're on these three medications? They actually are counteracting each other, the active ingredients, and it could be a detriment to you. We'd like to call your doctor. Anyway, they basically rewire a lot of things for the employee so that they don't, if the doctor says you need to take a medication, you're going to take it. And if you have a specialist over here saying take this, and your primary care saying take that, they're not talking to each other, unfortunately, and then you have two drugs that are unfortunately hurting the employee.
But this is not a pharmacy.
It
No.
is not a
Okay.
pharmacy.
Yeah.
They will clinically help manage
I
the
see.
employees and the drugs
I've got
that
it.
they take.
So they still go to their local pharmacist
Yeah.
for the drugs, but it's just it's a program to help them adhere to the drugs they need to take on, and then help them with costs on those high-costing drugs as well.
But if your doctor recommends that medicine, you stay on that medicine.
Absolutely. The pharmacist is there to help you stay compliant with your medication for like diabetics, high blood pressure, so they can see, hey, you've missed a script last month. Why did you miss that script? Oh, I couldn't afford it. Okay, well, if we could help you, get this generic, you could afford it and your copay would go down. Oh, great, I didn't know that. So it's just that kind of that very personal level communication with the member to help them navigate the healthcare system a little bit better, instead of going to the pharmacy and finding out that it's going to cost them, X, Y, Z, and they end up not filling the script. Great questions. Okay, really quickly, let's hit on slide 5, the network provider discounts. It's a little bit of a complex arrangement. I don't know how much you guys have talked about this in the past, but when you guys are with Blue Cross Blue Shield of Kansas, I'll just kind of help you kind of make some comparisons so you can kind of understand the differences. Blue Cross has allowed discounts at the facilities and providers. So the provider knows that Blue Cross will pay XYZ on a claim. That is the arrangement that you were doing for quite some time. You guys took a shift and went into a space that basically allows you to purchase and rent a network. And by doing so, you could bring in that reference-based pricing, which is using Medicare as a baseline for pricing instead of using the total charges and taking reductions down. Medicare is the baseline, so it's a better way to measure cost in the healthcare system. It's a little aggressive from a cost containment, but it's actually working well for you guys. That third party is the company HST. They're the vendor that actually negotiates with the facility for your employees. So your employees aren't doing that piece of it. That's what we have HST do. And really the point of this graph, and we always report on this for you guys annually, is just to show you on the left-hand side, if you were just using Providers Care Network, or the Blue Cross Blue Shield Network for that matter, would be pretty similar to these discounts. You can see in year 15, 16, and 17 what the hospital discount percentages were. All other would be like your physician office, labs, etc. And then the total discount. And then on the right-hand side is actually your guys' discounts that we've validated through your third-party administrator that pays the claims and with HST. So you can see you're outperforming the rentable network on the savings. And I just wanted, again, I think percentages are good, but I really wanted to take it down to just dollars and cents. So we went ahead and went back and just gave you what that claim savings meant to the city. So you can see it's substantial dollars that you guys are saving. And our role as your consultant is to really help making sure that the HST component is working well We do have hiccups from time to time, but that's what the IMA team gets involved in, and we work with Tiffany and her team. And that's really one of our big vendor oversights, is to making sure that that's working correctly. We are looking to find, currently, CoreSource is your third-party administrator. They pay your claims on your behalf. We are looking at other TPAs that would have a better intersection for the reference-based pricing, because it is a little unique, and that's not CoreSource's key competency for intersecting with HST. There's some other TPAs, as we call them, or third-party administrators, that do more with HST. So we're doing some due diligence this year that might actually enhance that experience a little bit more, and so we'll be reporting on that coming into fourth quarter. Questions on the reference-based pricing update?
I wish I had one.
And then this is just, like I mentioned on slide 6, this is actually what we provide your team. So the top graph is just our monthly reporting tracker. This is for the whole 2017 plan year, with claims costs through March, because you're gonna have run out claims for your plan year. So this is a true picture of what your budgeted costs were for 2017. I've just put a little magnifying glass at the bottom for really the number you want to focus in on is how you're running against your expected claims, and that's that 81.2%. So obviously running under expected is good. Those dollars that we funded to are now going into your reserve account, so good news there. So I just wanted to briefly show you guys that's what that monthly reporting looks like. And then you can see through May, you guys are running at 55%, and that's where that other little highlighted yellow total is. So running very well, plan is performing very well right now. So that was Tiffany's quarterly update too, I think.
So we
yeah.
talked about kind of where you were, where you are today, how we've done some great things. And then this future considerations, page 7, is just saying we've got a lot of work to do still, and we're going to continue to help you guys measure cost containment and continue to deliver saving strategies where we can. The back is the appendix, and this is really just supporting reports.
For any of you numbers junkies, if you want to look at numbers, the back appendix is actually part of our annual plan analysis that we provide to your team to help us make decisions coming into the renewal cycle. But it's great kind of appendix supporting items, and so we wanted to leave that for anybody that really likes to look at numbers and enjoys this type of information.
What questions can we answer if you have any?
I got mine answered.
Okay.
Anyone else? No?
Thank you, good job.
It's been
Thank
a
you.
pleasure working with you guys.
Yeah, really
Very-
fun working with your team.
Yes, so thank you very much.
Sounds
Thank
like
you.
you guys
Thank you.
can run a difficult operation dealing with the healthcare.
Yeah, but this is a fun one because you guys are doing such creative things and it's working, and so it's actually exciting
It's a lot of
to work in this space when we're getting results and gaining traction instead of the opposite, which can be very painful and not enjoyable.
So your other clients aren't doing as well as we are?
No, that's.
I would say you're
That
I would
was
say
quick.
with the other public entities that we work with, you're outperforming them by quite a margin.
A lot of
So-
people still want to kind of take the hands-off approach of managing their health plan and kind of not challenging status quo, and that seems to not be working. But, a lot of people don't like change and they're not open to new ideas, and so I think that's kind of the current that runs, just with employers, especially in public entity, because they don't want to change.
Sure.
And they don't want to leave maybe the large carrier that they've been with forever. So, yeah,
Thank you.
Thank you.
Thank you.
Appreciate the
Yeah.
information.
Thanks a bunch.
Thanks, guys.
With that, we'll close the study session and adjourn till 5:30.
Kids,